Hello, this is Marquel Thomas, and my topic for this week is head injury, concussion. Traumatic brain injury comprises tissue damage to the brain and its adjoining structures. Injury that results from TBI can be mild or severe. These injuries can be classified as either open or closed. Open head injuries result in more focal injuries. On the other hand, closed head injuries result in more multifocal or diffuse damage. Pathophysiology. Principal outcomes are from the initial injury and are associated with mechanical forces that split connections in the brain and produce contusions where the brain hits the skull surface. Axons to distant areas, fibers in the corpus callosum connecting the two hemispheres or both can be torn. Clinical findings of a head injury or concussion can imitate other disorders, so the diagnosis can be challenging. It is suggested that providers utilize the CDC's acute concussion evaluation tool. Information obtained should include how the injury occurred. Did the child lose any alterations in consciousness? Was any vomiting observed? A headache and the amount of pain? Any vision problems? Issues with ambulating and symptoms that occurred during the injury are all important. Physical examination. Vital signs should be obtained. These findings should then be compared to normal vital signs for a child at the same age. A neurological exam to include level of consciousness, functioning and reflexes, mental status, gross and fine motor skills. Examine the child for trauma such as fractures or a neck injury. Be attentive to signs of concussion symptoms. The CDC suggests using the Heads Up app for a reference. Finally, utilizing the Glasgow Coma Scale and the Pediatric Coma Scale can all aid in the physical exam of a head injury. Diagnostic testing. A CT scan is the gold standard for diagnosing head injuries or concussions. A CT scan should be performed when there is moderate to severe acute trauma. A CT scan is indicated for altered level of consciousness, seizures, persistent vomiting, amnesia about the injury, focal neurologic signs of defect, losing consciousness for a minute, and penetrating trauma or depressed skull fracture. Treatment. Treatment for head injury or concussion will depend on the type of injury. For a closed head injury and no loss of consciousness, observation. Observation can occur either in the child's home, the ED, or clinic. The child can be observed at home by a competent caregiver. They need to be educated on the signs and symptoms and what to look for regarding head injuries and concussions. The next type is a closed head injury and brief loss of consciousness. CT and observation is indicated for a brief loss of consciousness and when there are no other signs and symptoms of neurology or physical defects. Moderate head injury or worrisome symptoms. Hospitalization overnight for observation. This includes a child with a normal level of consciousness with a skull fracture or transient neurological findings. Follow-up and referral. Follow-up should occur with a primary care physician and in some instances a neurologist, depending on the type of head injury or concussion that occurred.